Sir, as shared by Minister Ong with this House earlier, welcome to Super Aged Singapore. This trend will accelerate. By 2030, 1 in 4 Singaporeans will be 65 years and older, and 1 in 4 of them will be aged 80 and above. Within the next decade, by 2040, 1 in 3 seniors will be aged 80 and above. Seniors will likely need more support. For example, seniors use 8 times the amount of hospital care than those who are younger. So I agree with many members who spoke on the implications. First, to caregivers. Today it's not uncommon to see a working adult supporting elderly parents in their late 60s who are in turn taking care of the parents in their late 80s. I certainly see many of such families in my constituency. With family size continuing to shrink, the burden on caregivers will only get heavier. Secondly, there will be increasing pressure on the healthcare system. If half of our seniors have at least one chronic disease, we will have to care for close to 500,000 of them in 2030, up from about 400,000 of them last year. That is why we want our seniors to remain healthy for as long as possible. As Minister said, it's not just about living longer, but also living healthier for longer. Today, I will outline how we are doing so with technology as an enabler. First, getting seniors to age well in the community. Second, wrapping care around them. Third, supporting healthcare providers to deliver better outcomes. As pointed out by a number of members, many seniors face social isolation. A study has estimated that this risk is equivalent to smoking 15 cigarettes a day. Members will be familiar with the Silver Generation Office, or SGO. Since 2022, SGO has started preventive health visits, engaged more than 600,000 seniors, and connected those with needs to services like active aging centers, or AACs, senior care centers, or SCCs, and community mental health services. Recognizing that younger seniors are more digitally savvy, SGO is reaching out to this group through a live SG app. And since December last year, over 3,000 seniors have received personalized recommendations on services useful to them. So for seniors who have not yet availed themselves to this application, this service, please check out the live SG app. We have also grown the AAC network from 154 centers to over 230 over the last 2 years, now serving around 100,000 seniors. More than 150 SCCs provide daycare services, including for those with dementia and respite care. And over 90 community outreach and intervention teams offer psychosocial support. We will continue to expand these services. Mr. Ng Chee Meng, Mr. Yip Hong Wing, and Mr. Fadli Fauzi spoke up for caregivers and referenced what other countries are doing to recognize and support caregivers. Like members, we believe that caregivers play a vital role, and we are doing more to support them. We are enhancing long-term care subsidies and grants, and this year, we will raise the per capita household income, or PCHI, threshold from $3,600 to $4,800. This will cover about 7 in 10 households. I'd like to assure Mr. Ng Chee Meng and Ms. Mariam Jaafar that these subsidies are not dependent on the number of activities of daily living needs, or ADLs. Last year, caregivers of over 14,000 seniors benefited from subsidized home and center-based respite services. We will do more. From 1st April, more than 5,600 eligible seniors and their caregivers can benefit from the Enhanced Home Personal Care, or HPC Plus service, featuring home-based respite care, medication reminders, and 24/7 technology-enabled monitoring for fall detection and incident reporting. Members also spoke about caregivers who are juggling work and care. We empathize with their challenges. Support is available through various ministries' effort. For example, flexible work arrangements and a caregivers training grant, which helps to offset costs for training family caregivers and migrant domestic workers. Eligible caregivers can also tap on enhanced parental leave provisions, such as a new shared parental leave and unpaid infant leave, care leave. We will continue to study member suggestions as we explore ways to better support our caregivers. Mr. Victor Lai spoke about the unintended consequences of relying on PCHI to assess the caregiving circumstances of families. I appreciate his concerns. The PCHI means testing approach was discussed at the budget debate last week. MOH takes stressing from this framework. However, individuals in difficult circumstances who require additional support can approach our medical social workers. Mr. Lai gave a few suggestions on how we can improve the current framework. MOH will study his suggestions with the Ministry of Finance. Mr. Terence Ho and Mr. Eric Chua advocated for seniors to contribute to the community, including helping fellow seniors. I agree. Such involvement gives our seniors a sense of purpose. Seniors can tap on volunteering opportunities, with some organizations providing training and allowances. For example, as Silver Generation ambassadors, they help conduct outreach to other seniors. Seniors can also join the SG Healthcare Corps to assist with basic patient care. Those aged 50 and above comprise 20 to 40% of volunteers across these programs, and we welcome more partners to join this effort. Let me turn to the topic of end of life. I agree with Mr. Yip Hong Wing's point that we want our seniors to live well, or as the Chinese say, 安然离去. Since 2023, we have significantly expanded community palliative care services, enhanced subsidies, and facilitated hospital discharges at the end of life. We want more Singaporeans to spend their final days at home in an environment where they feel comfortable, surrounded by loved ones. The response has been positive. As of June 2025, the utilization rate for home palliative care was around 90%. We will expand capacity as demand grows. We want to continue supporting families who wish to be with their loved ones at home during their final journey. Next, I assure Mr. Chai Ying-jo and Mr. Yip Hong Wing that we do track outcomes of our programs, such as frailty prevalence, social participation, and caregiver well-being. We do so with different parties, including research institutions. Let me now turn to care delivery transformation. By 2030, around 100,000 seniors will need help with at least one daily activity like eating or showering. They will likely need services from different service providers. We want their experience to be as seamless as possible and not have to run from pillar to post to receive these services. Technology will be a key enabler for tighter care coordination. So I agree with Mr. Chai's point that we want to make it easier for seniors to access social and health services. First, we have introduced integrated community care providers, or ICCPs, in 84 sub-regions around Singapore. This means a single party to coordinate care for seniors within each area. Currently, seniors undergo multiple care assessments done by different service providers they go to. Not only this duplicate effort for providers and create greater inconvenience for our seniors may also end up with uncoordinated care due to different care plans. We will streamline this entire process. From next month, seniors requiring multiple long-term care services will need only one comprehensive assessment done by the ICCP using a standardized, internationally recognized tool. Each senior will have a single community care plan developed based on this assessment. Every provider that a senior goes to will take reference from this care plan. Such an approach will ensure seniors benefit from a seamless experience and better coordinated care. We will progressively roll this out from October this year. And we are enabling this new way of coordinating and delivering services through a common IT platform for community care providers. Mr. Azhar Othman asked about teleconsultation. I refer the member to SMS Kopukun's recent response to a parliamentary question on this matter. But fundamentally, MOH agrees with the member to make good use of technology to improve the healthcare experiences for our patients. For example, the Productivity and Digitalization Grant, launched in 2022, has supported more than 240 projects, such as systems to automate showering and vital signs monitoring. We intend to enhance the grant to make better use of technology solutions in the healthcare sector, including harnessing robotics and artificial intelligence. So when I brought this House through the Health Information Bill in January, I said that MOH will help healthcare providers meet the provisions. I'm pleased to provide an update. First, we are working with the vendors for health information management systems used by healthcare providers to comply with the necessary requirements. Second, we will provide resource guides and training to help healthcare providers and their staff understand and implement these requirements. Third, we will launch the National Electronic Health Record Connect Grant, or NEHR Connect Grant, and open it for application in July this year. The grant will offset the cost for providers to onboard the NEHR. For typical healthcare providers, this grant will cover up to 2 years of subscription costs for the health information management systems. For providers with in-house systems, the funding support covers up to 40% of enhancement costs. MOH will set aside up to $45 million for this. Let me illustrate how this works for a typical clinic with 5 staff. Most of them already subscribe to a health information management system. They can apply and benefit from the NEHR Connect Grant. On top of the NEHR Connect Grant, the clinic can receive up to 70% co-funding support from the Cyber Security Agency of Singapore to engage cybersecurity consultants. They also benefit from up to 50% funding support from Enterprise SG to adopt cybersecurity solutions such as those for anti-malware. In total, the clinic can receive about $20,000 in grants. Sir, in Mandarin, please. 在新年期间，我与大家交换祝福时，察觉到年长者已较少说恭喜发财，而是多说身体健康。他们明白保持健康的重要性，尤其是在疫情之后。为了鼓励年长者继续保持身心健康，我们设立了超过230间活跃中心。今年，我们也将指定综合社区护理服务团队。让我再说一次，今年我们也将指定综合社区护理服务业者。护理团队将根据年长者的需求，为他们协调与计划更全面的保健护理。举个例子，如果年长者需要居家个人照料服务，同时也要到乐龄护理中心，他们只需要与一个护理团队联系就可以了，减少联络不同社区护理的麻烦。 我们也在积极地运用科技，为国人提供更精准与便利的护理体验。比如，有跌倒风险的年长者，可以在优化居家个人照料下，享有24小时的智能监测。如果真的不幸发生意外，系统能及时的通知相关人员来帮忙。这样一来，年长者的家属也能安心一点。如今，越来越多年长者对科技比较有掌握，因此，关爱乐龄办事处通过 Life SG 应用程序与年长者互动，为他们设定个人健康计划。从去年12月起，已经有超过3000名年长者从中获益。从今年7月起，全科医生可以在电脑系统里查看专科医生、医院和其他医疗机构之前为病人记录的健康资料。这样一来，医生能够更全面地了解病人的情况，为他们制定最适合的个人化的健康计划。所以，病人看医生时不需要再重复个人病历，我们的阿公阿嬷也不需要头痛和担心医生之前给了什么诊断，开了什么药方。俗语说得好，家有一老，如有一宝。我们正在积极运用科技提升护理质量，确保年长者能在熟悉的环境中接受治疗。我们会继续扩展这些服务，让每一位年长者都能获得所需要的关怀和支持。我们要我们的家里的老宝贝们健健康康、开开心心、安享晚年。So back to English. Through the Health Information Act and other digital health priorities, we are building a more connected, responsive, and secure health system. This is in support of our broader healthcare transformation to anchor care in the community with more coordinated services that wrap around our seniors. Importantly, a healthcare system that puts people first. Thank you.